Hi. How are you? I'm here to see Dr. Sam.
At age 77, retired beauty salon owner Helen Durham has battled a range of illnesses, from high blood pressure and high cholesterol to a potentially life-threatening blood clot.
Right in here.
Okay.
On this day, Durham has come to the Richmond, Virginia clinic of JenCare, a division of ChenMed. She's meeting with her longtime physician, Dr. Shruti Sambamurthy, who's also known by her patients as Dr. Sam.
Hi, Mr. How are you doing? So good to see you. Oh my gosh, 30 days, huh?
Durham has been a patient at this clinic for 11 years and a patient of Dr. Sam's for the past 6. It's not just physical ailments that the doctors helped Durham with, but also emotional issues, including the recent death of her adult son from complications of diabetes.
She has needed frequent visits over the past couple of years just to really help her cope with the grieving process, especially losing her son. Unfortunately, during those times, she also ended up having health conditions because of that.
Make sure that we're mentally happy.
Right. Dr. Sam could see me slipping mentally. So I would go to my regular visits, and she would look at me and she would say, Miss Durham, are you okay? And she said, no, you're not. She's not a psychiatrist or a psychologist, but she seemed like one to me. That was the lifeline I needed, because right before my son died, my sister, I had just lost my only sister, and then my mom before her. So that was just, I was at my wit's end. And if it wasn't for her, I don't know how I would have gotten through it.
These close connections between doctors and patients are par for the course at JenCare, where most of the patients are older adults enrolled in Medicare Advantage plans. They benefit from a holistic care model that takes full accountability of their care, its costs, its quality, and their overall health.
We're talking about seniors that are living under conditions where they're not able to just take care of themselves, never mind their complex medical conditions. And I think instead of really focusing on the reactive approach of medicine, what we're trying to do is the proactive approach of medicine, where you're able to prevent medical conditions from happening. So that way you're really reducing catastrophic events in patients' lives.
The approach is sometimes called value-based healthcare. And to patients like Helen Durham, it's precious.
Oh, okay.
Right.
That's where the pain is, the stiffness is coming from.
Exactly.
It's invaluable. I don't think you can put a price on it, because it's something that in my 77 I've never seen, and I've had some of the best doctors living in Washington, D.C. I've never seen this level of detail and this level of attention to patients, kindness, attentiveness, going the extra yard, the extra mile to make you feel like you're important. That's what we need. And I think they need more of these type of centers.
There are other key features of this care model as well, says JenCare's Regional Chief Clinical Officer, Stephen Lewis.
The care that you can provide in a value-based setting is, it gives you the ability to build a relationship with your patients. We're much more available to our patients. And I think that the accountability piece is really important in value-based care.
The financial arrangements underlying the model make this accountability and these closer relationships possible, Dr. Lewis says. They're different from the most common arrangements in U.S. healthcare. Doctors are usually paid on a fee-for-service basis for each visit or procedure in most common insurance arrangements, or by the Centers for Medicare and Medicaid Services, known as CMS, which handles payments to providers under the traditional Medicare program. By contrast, Dr. Lewis explains, practices like JenCare's are paid very differently under arrangements like Medicare Advantage.
We are full risk value-based care, which means that we get paid on a monthly basis to care for our patients. And we look at the risk of our patients. And the CMS and the insurance companies tell us, okay, this is how much it should cost for care for those patients. And so if we're able to provide them great care, we're able to keep them out of needing to go to the hospitals and emergency departments all the time, then we're able to do well. And so what that monthly payment does is it allows us to be able to have smaller panels. So our doctors here carry 450 patients. We are able to see our patients more often because we have a smaller panel. Most fee-for-service doctors may carry thousands, 2,000 to 5,000 patients, depending on where they work. And so we carry smaller panels, we have a closer relationship. We see our patients monthly, that's our goal. Though sometimes if they're sick, we will see them more often. Our sicker patients we will see twice a month. And so being able to receive that monthly payment for our patients in a value-based setting directly leads to us being able to provide closer care, better care for the patients that we have.
The financial underpinnings of the model also enable its other key aspects, such as coordinated care for patients like Daphne Dudley, who's disabled and has health coverage from both Medicare and Medicaid.
All right, take your time to step down.
Ms. Dudley is a 59-year-old. She has history of Crohn's disease and ulcerative colitis, which is inflammation in her bowel. She's also pre-diabetic, has had some elevated blood pressures before as well. So the biggest thing is really for patients like Ms. Dudley and a lot of our patients is the actual coordination of the care that they're receiving. Oftentimes, in primary care, our patients, particularly if they're complex, are seeing a lot of specialists. And so having that understanding of what's happening with all the specialists, kind of being the quarterback of what's happening with them and letting them know the indications of different procedures and why they should or should not do certain things is really helpful. And so a lot of the time what we're doing is explaining the care that they're receiving and kind of helping them navigate and understand what all the different specialists that they're working with are recommending and why. If you're having stomach upset, it's important that you let us know.
Patient Daphne Dudley says that coordination of care with JenCare's physicians like Dr. Lewis extends to financial matters as well.
Most people, they worried about bills, how to pay bills. A lot of people don't go to hospitals and facilities because they are worried about a bill, paying a copay, none of that. He makes sure that, hey, before I do this, I'm gonna get my coordinators to call your insurance.
Still, other aspects of JenCare's value-based care are as appealing to doctors as to patients, says Dr. Sam.
I became a clinician because I wanted to deliver good outcomes to my seniors. I want to practice in a place where I can actually practice medicine for the reason I went into practice medicine, that is take care of people. This is what human beings do. And a model like this is a perfect platform to do that.
That includes having some specialists, like cardiologist Preeti Dubey, practicing right on site and able to consult frequently with many of the clinic's patients.
When we see our patients who are above 65 years of age, majority of them have certain congestive heart failure, whether they have blockages in the heart, some kind of heart conditions. How do we prevent them from getting further sick? How do we manage the conditions that they currently have from worsening, from progressing to the point where they might need ER visits or hospitalization? So it's a close collaboration where the center of focus is our patients.
Having this broad care team in place is another strength of the value-based model. That includes having a nurse on hand after normal business hours to take urgent calls from patients and even dispatch paramedics to their homes if needed.
But they can go give medicines, they can evaluate the patient. We triage to figure out what's going on with them. And if they need to go to the hospital, then we will call the hospital, basically making sure that the emergency department docs and the hospital docs have all the information that they need to care for the patient.
And even when JenCare's patients are hospitalized, the close connections don't stop. Dr. Paula Palomino was until recently JenCare's regional medical director.
I lead a fantastic group of social workers, nurses, coordinators, and what we do is we talk to each other. We have these morning, daily meetings with the center medical directors of every center, and we talk about what is going on with their patients. What is the discharge disposition, meaning is the patient ready to maybe leave the hospital in 1 or 2 days? Is this patient going home? Is this patient going to rehab? Will the patient need any help with any device or any medication? So we try to make sure that that patient is going to be discharged in a safe way, so that way we prevent readmissions and we make sure that that patient can go back to their PCP, which is the primary care provider.
Follow-up care continues when the patient is home, said Dr. Palomino.
Our social worker will make a phone call to see if the patient has any problems with shelter or any economical difficulties. We can do home visits. We can see if the patient has any support at home, because everything that we do here is preventive.
It's the very essence of the value-based care model.
The secret sauce is the trust that you develop through relationships with your patients. So you get the time to know who they are, their backgrounds, their history, not just their medical concerns, but also we take it personal. We get connected to an emotional level, and we really care for the patient as a whole, not just, oh, you have diabetes and you need medications. We also care about when was the last time you talked to your son? You know, when was the last time your daughter visited you? Do you have relationships with your grandkids? So we want to know, because we understand that it's not just about the physical health, it's your mental health. It's making sure that our elderly population has that social life that will keep them healthy. So it's the trust that we develop with our patients. They trust us to care for them, and we trust them to follow the recommendations that we provide to them.
Relationships, trust, accountability, teamwork, prevention, and coordination are all at the very heart of value-based care.
And if you need anything, text me, okay?
Okay, I have your number. I'll text you.
It was truly a pleasure to see you, as always.
Well, Doc, you know what? You're one of the bright lights in my life, so thank you for keeping me healthy and for always knowing when I did not take my medicine.
Right.